Bismillah ar-Rahman ar-Rahim. With you, Dr. Wissam Mahmoud Hassan. I'm a family medicine consultant. Also, I am a member in the Royal College of General Practitioners in the UK. I am an active member in the College of Family Physicians of Canada. In the previous video, we have been talking about rheumatoid arthritis. Today, I want to talk with you about osteoarthritis. Osteoarthritis is a common degenerative disorder of the articular cartilage. It is associated with hypertrophic bone changes. The patient mostly affected with rheumatoid arthritis are older patients, especially older than 50 years, female patient, overweight or obese. So we recommend for patients with knee and hip osteoarthritis to reduce their weight. Patients with previous joint injury, patients with a job that requires bending or squatting with family history, also patients that participate in sports associated with repetitive impact as in soccer and American football. Osteoarthritis, primarily clinical diagnosis. The patient come with joint pain, minimal morning stiffness, and functional impairment, especially in patients older than 50 years. Regarding the pain, pain mostly during flexion, pain mostly in the fingers, shoulders, hips, knees, or ankles. That means osteoarthritis is common in large joints. Pain is also typically worse later in the day and relieved by rest. The patient come with the complaint that in the morning the pain is less, and during the work during the day the pain become more worse. Okay, that is regarding the first presentation, which is the joint pain. Second presentation is minimal morning stiffness. The patient come with minimal morning stiffness, mostly less than half hour. The third presentation is functional impairment or functional limitation. For example, in patient with knee osteoarthritis, the patient is complaining of difficulty walking down the stairs, also have a clinical finding of decreased range of motion, effusion, and crepitus. All are clinical findings in patients with knee osteoarthritis. Bony enlargement in prolonged or severe osteoarthritis occurred as joint swelling and tenderness with or without crepitus. We can find Heberden nodes. This is hard or bony swelling, osteophytes in distal interphalangeal joints, and butchered nodes in proximal interphalangeal joints. Both Heberden and butchered nodes may or may not be painful. Alternative diagnosis should be considered in patients with inflammation, erythema, or pain, especially if increased or changed significantly. Diagnostic testing. Radiography can confirm the diagnosis and may be helpful before surgical referral, but findings generally don't correlate with the symptoms. So radiography is not required to diagnose osteoarthritis, especially in patients with risk factors and typical symptoms. In X-ray, we can notice loss of joint space, osteophytes, subchondral cyst, subchondral sclerosis. Subchondral cyst as in knee osteoarthritis in the form of Packard or popliteal cysts. Regarding suggested treatment approach to patients with osteoarthritis, the first line is weight loss. Weight loss has been recommended for patients especially with knee and hip osteoarthritis. First line treatment is full dose acetaminophen or paracetamol, topical therapies, exercise, Tai Chi. Tai Chi is a group of exercises that maintain joint mobility and muscle flexibility. In addition, knee tapping, physical therapy. Hip osteoarthritis have a special recommendation that physical therapy was not benefit for a patient with hip osteoarthritis. Second line treatment is non-steroidal anti-inflammatory drugs. Third line is tramadol or duloxetine. Fourth line treatment is opiates that need carefully supervised in the form of 50 milligram of hydrocodone or 30 milligram of oxycodone per day or less. Regarding corticosteroid injection may be helpful in the short-term treatment. Joint replacement in patients with moderate to severe pain. We want to discuss the most important point in this topic, that vitamin D supplements, shoes specifically designed for persons with osteoarthritis, antioxidant supplement, physical therapy for hip osteoarthritis, and hyaluronic acid injections, all of those are not effective in treatment of osteoarthritis. This is according to American Academy of Family Physicians. Thank you for your attention.